Health Cabinet Secretary Mutahi Kagwe took Kenyans through the treacherous journey of the 1918 Spanish flu pandemic that wiped out 50 million lives globally, as he warned of a looming second wave of the coronavirus in the country. According to Kagwe, since the easing of the containment measures, new infections had risen to worrying levels and the country was on the tipping point.
There is no doubt that we are witnessing what our modeling team this morning were calling a case of new infections. We are heading for a second wave without doubt.
Kagwe putting owners of restaurants, bars and entertainment joints and Kenyans defying containment measures on notice, warning that the government was reconsidering some of the restriction measures lifted last month.
The spike we are witnessing has not just erupted out of nowhere. It has in part been triggered by wanton violations of containment protocols and advice from our experts. I am told that bars are neither requiring their patrons to observe social distancing nor asking them to wear masks, and they seem to be under the impression that sanitization at the door is a sufficient requirement for service. That once Jerusalem gets in, all measures go out.
If we lose this individual responsibility that we're supposed to have, then we go back to a situation where it's now between health and the economy. And health will always be the one that takes preference.
Politicians who are leading Kenyans in defying the directives were also warned that they risk plunging the country into unwanted territory.
Leadership is leading by example. If leaders do not observe the measures given going to political rallies and other gatherings, the signals that they send to the public is that all is well. Yet we know that it is not.
According to Kagwe, by October 1st, 2 days after easing of the restrictions, the country's positivity rate was 4%. A day later, it rose to 7%, and by October 3rd, it was 8%. Today, with 685 new infections over the last 24 hours, the positivity rate has hit 12%.
Counties like Kilifi, Nakuru, Turkana, Trans Nzoia, Kisii, Kisumu, and Bungoma are also on a worrying trajectory.
With the increase in new infections resulting in an increase in hospital admissions and number of deaths, it is clear that Kenyans are flirting with a second wave. The severity of this second wave is still not known. Health officials concerned with the fact that close to 1,000 patients have been admitted in hospitals and the number of those seeking intensive care management was on the rise.
Today again we have 28 people in ICU, 10 of them under ventilatory support, 14 on supplemental oxygen and 4 under observation. Again telling you that we are getting more severe form of the disease.
The younger people are the ones who are taking the greatest risks with this disease and flirting with it. This is not a problem for the youth as such. We are seeing a return to normalcy even amongst health workers. These times are not normal, and please do not treat them normally.
More patients continue to succumb to the effects of the virus. In the last 24 hours, 7 lost the battle.
All age groups are affected. We are losing more and more people who are younger and who don't have any coexisting medical conditions. So the more the need for us to be able to take the necessary precautionary measures as we have continued to articulate.
With the phased reopening of schools underway amid the rising number of infections, the health officials advised parents to exercise more caution to avoid passing on the virus to children who in turn pass it along to their classmates, resulting in a disaster. Enforcement agencies were also tasked to deal with Kenyans who had dropped the ball. The Ministry of Health is warning that if the infection prevention measures that have been outlined are not followed, then things could be worse. Chemutai Goin, Citizen TV, Nairobi.